Orion Stewart. I'm the chief of the Unintentional Injury Prevention Data Unit at the California Department of Public Health's Injury and Violence Prevention Branch. I've been doing this work for a little more than 5 years now, and really got involved in drowning prevention and surveillance through the California Water Safety Coalition, who reached out to CDPH and really has been pushing us to do more data surveillance work around drowning. And through them, we recently have a new legislation in our state to really dig into childhood drowning data with the intention of using that data to inform a California water safety action plan for children.
Nice. So what are the data sources that are available to say, like, not even to those in the space specifically in epidemiology or in public health, but to the general public? If someone was interested in finding data within the state of California, what are the sources that they could look to?
So I would recommend starting with our CDPH Epicenter site. This is our data dashboard that we use for general injury surveillance. And yeah, sorry, can I drop links or share a screen or?
Oh, absolutely. Anything that you drop into the chat, I can capture and then add it kind of in the summary.
Yeah, sounds good. So let me pull up the chat. So that is the link to our Epicenter site. And
Great.
What we do in the Injury and Violence Prevention Branch at CDPH is take our state vital statistics death data, and then our hospital and ED discharge data from the state, take those data, use CDC guidance to identify and classify injuries that are either result in death or treatment at the ED or the hospital. And then from those data, we can identify drownings. And so on that website, it's sort of I describe it as a choose your own adventure, where you can go in and query specific injury topics, specific age groups, specific locations, counties, or regions in the state, and then just look at numbers or rates of the injury of interest. In this case, it would be drownings. And so it's a really powerful tool, but it also requires a bit of knowledge of the topic. So for example, for drownings, most people think of them as accidents or unintentional injuries, which most of them are, but there are also cases of drownings where it's a homicide or a suicide. And so those are also available on the site. But within the site, you can select the mechanism of drowning, but then you would have to sort of specify the intent. Do you want all intents or just unintentional? There are also some limitations in the way that the CDC guidance has us doing our injury surveillance. So, for example, for the deaths, we only look at drowning as the underlying cause of death. We wouldn't look at drownings where it's a contributing cause of death. So for example, if somebody crashed their car into a body of water and then drowned, that would show up as a motor vehicle death, not a drowning death. So there's some nuances there. But I think, compared to the benefits of the site and being able to just sort of access those data, those drawbacks are relatively minor.
Okay. Do you also, in that database, are they capturing non-fatal information as well?
Yeah, so it would be non-fatal drownings that are treated at a hospital or an ED. And from our hospital and ED data, we exclude those drownings that were treated and then the person died in the hospital or ED, just so we're not double counting with the death data. It's limited to state licensed facilities. So it would exclude federally licensed facilities, so like VA hospitals. And then we also, for our injury surveillance, it's population based, so we exclude non-residents. So that's also unfortunate for drowning work, where we do get visitors to California, uh, and it's sort of a blind spot in our drowning surveillance based on these data.
So where do those, because it was an interesting, similar conversation with the state of Florida, right? A lot of visitors to the state of Florida, much like a lot of visitors to the state of California. What happens with that data? So if you have a non-residence, right, does that go back to the state that they're from, or does it just?
So yeah, it depends. So for deaths, it would go back to the state where they're from. So in our death data on the epicenter site, we include Californians who may have drowned in other states. And then for the non-fatals, they're just excluded from the data. And so they're just not reported anywhere, basically. And this is something that we are aware of and are working on. And so I mentioned the California Water Safety Coalition and like pushing us to do more with drowning. And so we do intend to produce like a data report, data brief on drownings, where we will be able to include those non-resident drownings and sort of have a better sense of the complete burden of drowning, not just per injury surveillance guidelines.
Yeah, and from the coalition standpoint and the strategy that's been developed and is still in development, right? Like I would assume that there will be strategies put into place based on the tourism factor, right? And the deaths based on tourism. And so there's a whole communication, PR, marketing kind of component to that would have to be layered in, I would assume, to the strategy in general.
Yeah, I think so. And I think it's an interesting distinction for prevention purposes, like for your sort of local residents that you might be able to reach through swim lessons or through certain media outlets versus people who are out of town and, are going to have different sort of intervention necessary.
So one of the other pieces that we haven't delved into in some of the other states yet, that I think just is kind of that, as we talk about the tourism piece of things, the data that comes to you or within that database, how specific does it get? So do we know that, obviously we know that they weren't residents, but do we know that they were, I don't know, at a rental property that maybe didn't have, I don't know, barriers, or they weren't aware of being more stringent on their supervision, or how detailed does the data go, I guess?
Yeah, and again, I would say it depends on the severity of the injury. And so for deaths, there are a lot more details collected compared to non-fatal hospitalizations or ED visits. So in the death data, that we get, these are based on coroner and medical examiner reports and are sort of make their way into a database. And so there's like a brief text description of the circumstances of the injury. And we can do some work like searching for keywords. There's XY coordinates of where the injury occurred. And so, we don't quite have the capacity yet, but presumably, you get down into identifying whether or not that was a rental property based on the geolocation. For hospitalizations and ED visits, it's very basic sort of demographic ICD-10 CM codes that describe the injury and the diagnosis. We don't have any information on the location. The body of water is really limited. So that's really unfortunate for the non-fatal drownings, which we see are about for every fatal drowning, there's about 3 non-fatal drownings that are treated at emergency departments or hospitals. Um, for so the death data that I just described is sort of our standard state vital statistics death data. There are also data systems that allow for much more detailed data collection, one of which is the child death review team process. Here in California, that's at the county level, and there's a high degree of variation in sort of the resources and capacity of those teams within our 58 counties. But the purpose of those child death review teams is to do a very thorough review of child fatality. So they will not only look at the coroner's report, they'll look at the law enforcement report, child protective services, sit down with pediatricians and other experts and come to an understanding of how the death occurred, if it could have been prevented, very thorough case review. And then the National Center for Child Fatality Review and Prevention has a database that those reports can then be sort of entered into a database that is accessible to public health departments. And so we get those data. We see that across the state, about 25% of child drownings are actually entered into those into that database. So we're not we're far from having a complete caseload, and oftentimes the cases are where it's suspected neglect or abuse, and so more on the, I guess, homicide or negligent deaths than purely unintentional. But all that to say is that for deaths, there are data systems in place where a more thorough review can occur.
Okay. And those, so in data systems like that, they're then feeding kind of up, if you will, to the larger database. So if someone was looking for more detail to see trends, how would they find that information?
So I mean, again, I would start with Epicenter. The benefit of that site is that it's complete case capture. So we get all the deaths that are recorded in the state. We get all the hospital and ED visits that are treated at state licensed facilities. And so it's consistently collected and it's useful for looking at trends over time. With the child death review team data, it's varies from year to year how many cases are reported. With the pandemic, there was a drop in reporting. And so it's more like a database that looks like a case series rather than a random sample or a census. But I think there's, like, even with that limitation, there's still power in sort of observing trends that pop out from those cases that are reviewed. And so for researchers, they can contact the National Center directly to receive those data. In California, many of the county level child death review teams will produce reports. Sacramento County is well known for being a very thorough county and reviews every single child death. And so the reports that it produces can be used to really understand the nuances of drowning circumstances among children in the county. So it really varies from county to county. But the National Center is a good place to go for those data.
Yeah. So, but it also sounds like, so if someone is looking to develop a state plan, to also consider looping in maybe the representative at the county level across their state so that they can garner a little bit more detail into the information, perhaps.
Yeah, and my understanding is that the child death review team process is organized differently across states. I think for some states it's at the state level. So there's perhaps just one person to go to versus
Okay.
a place like California where you know, have to contact 58 different the child death review teams to get everybody on board.
Are there other data sources in your state that maybe aren't publicly available, but if you, obviously sometimes you can find data through relationships, or there are partner organizations that have information that maybe isn't collected in the same fashion. Are there any circumstances like that within the state of California? So, for example, in speaking with New York, one of the things that came up was that the data from the Coast Guard, that feeding into, if they were to layer that data in with some of the other data that they've had, then there would be potentially some duplicate efforts or some duplicate data involved. So do you find that to be the case in any of the other data sources in your area?
Uh, Potentially. So I guess so our California state parks, uh, they have a lifeguard division and collect data on drownings that occur on their lifeguarded beaches and state parks property, basically. And then within state parks is the Division of Boating and Waterways, and they will collect the, I think it's the BARD data that goes to the Coast Guard, the boating accident reporting database. And so those are like very specific data sources, boating accidents. I forget the exact criteria of what, would end up in that database. And then, drownings that occur on state parks. And so those would be redundant to the data that we're seeing in our death data. They would probably have more details on the circumstances and, information from the first responders. So it could be a bit of a redundancy, but also the opportunity to start linking those data sets and, collecting information from people who were on the scene and could do a great job of describing the circumstances. And then the sort of medical data that comes later from either the coroner or medical examiner or the provider at the hospital or ED. And then on that note, there are a few sort of county level databases where there's some linkage going on between the EMS first responder and the hospital system in the area. And so one of them is in Riverside and the other is in Orange County. And both of them have sort of been able to add on additional data collection forms when an EMS responds to a drowning event. And so they'll collect information pertinent to drownings. And then in the Riverside system, somebody from public health is notified when that happens, and then they follow up with the hospital to link that EMS response form to the hospital outcomes data. And my understanding is that it's very similar to the CARES registry system, where it's circumstances on the scene from the first responder and then like hospital data later.
So, advice for someone who doesn't necessarily have an epidemiology background, right? And they're trying to help develop this strategy within their state or their county or community. What would you recommend be their first step wherever it is that they reside?
Oh gosh. Yeah, I mean in California there's a lot of so we have the California Water Safety Coalition, which is a statewide group of just all the various players in drowning prevention. And it's a very diverse field, lifeguards, pool managers, pediatricians. And so it's a great place where sort of all that knowledge comes together in one place. There's a lot of local organizations that sort of have a similar structure, but are locally oriented. And so just tapping into that network is a great place to start. reaching out to either the state or the local public health department. I mean, we're here to support these efforts. There's nothing I enjoy more than getting our data into the hands of somebody that can actually do something with it. And so we provide technical assistance. You know, if you don't have a background in statistics, we can help you with the numbers, getting the appropriate numbers for whatever needs you might have. And I imagine that there are people who would do that at the local health department level as well.
So they would potentially be able to help kind of figure out what the trends are, like what the data is showing the trends to be over a course of time.
Yeah, to helping, I guess, yeah, not only providing data, but helping to interpret it and informing, yeah, identifying places of possible intervention. And then also just like identifying where data are available. So for going back to the child death review teams, again, Sacramento County has a great child death review team. They've reviewed every single child drowning case that comes through to them. And so knowing that that exists, like, and being able to dig into those data and really looking at the circumstances, like was there supervision when the drowning occurred? Was there fencing around the residential pool where the drowning happened? That sort of information is going to be much more useful for designing an intervention. I think it's more of the modifiable risk factors versus things that are sort of already well known, like the how the risk varies by age or gender, things like that.
Is there anything, as you look at resources or the way that California goes about gathering their data and utilizing their data, is there anything that you could call out as, I don't know, a real positive for the state?
Yeah, so I think that the epicenter site is definitely a great statewide resource. Again, to just identify those basic trends and burden. It has very little information on the circumstances that are of interest, which is unfortunate. And then at the local level, there's some really great systems in place. It's just very variable across the state. So again, going back to the child death review team in Sacramento, great example of a system that's really able to provide those details on the circumstances. The examples of the systems in Riverside and Orange County where they're collecting information from the scene from EMS responders. So there's some really great examples of local data sources. They're just not quite statewide yet, and we are hoping to identify those and work to expand them so that they eventually are statewide.
Great. Anything else that you'd like to share about the resources or the data that's available in the state of California, or around the strategy and the plans that you have going forward?
Yeah, you know, I don't know if there's much to add.
Okay,
Yeah, in
that's okay.
California, yeah, we've got a great California Water Safety Coalition. You know, their website is like a great starting place, and just tapping into that sort of clearinghouse of information. And then, yeah, statewide, Epicenter is a great data resource, and then really at the county level, it's pretty variable, but local public health department is a great place to start.
Awesome. Great. Well, that's all I have. So I appreciate your time. I appreciate you taking the time to share this information with me today so that we can share it with others. So
yeah,
really helpful.
thanks. Yeah, my pleasure. Thanks for the opportunity. And yeah, if there's any follow-up questions or clarification, just just let me know.
Great. Thanks so much.